an ambulance when I need one. Give me something for my pain. Tell the government to pay the hospital. I'll be back on my feet again.
I'm going to introduce myself as Khamis. I'm with the community group Acorn and Healthcare for America now. And we are speaking with Ms. Valerie Stella in Farmington Hills. And we're talking about the need for quality, affordable health care and why it's so important to everyone in America. And what I'd like to do is just allow Ms. Valerie to talk to me for a few minutes.
I was injured in a workers' comp accident in January of 2004. And when his group came around and they were telling us that they were interested in all the concerns people had about health care, I had a lot of major points that I thought I could make with them. The workers' comp system here in Michigan is not working at all, and that's because after they made the changes 20 years ago, instead of clients or applicants taking advantage of the system, our insurance companies and our unethical employers are taking advantage of the system now. So I am now disabled and crippled when if I could have gotten the correct care at the right point in time, I probably could have gotten well and returned to work. And that my career in quality and manufacturing would not have been interrupted. During the time that I've been going through all the steps to try and get my situation taken care of, I've ran into a lot of other problems with the healthcare system, and I've also found that this wasn't just happening to me, that it's happening to hundreds and thousands of people.
So when did this start with you?
My accident was on January 13th of 2004.
And it was work-related?
Yes. And my company, instead of being able to have their own workers' comp insurance to be self-insured, they had to use the insurer of choice here in Michigan, which is Accident Fund.
So as an employer, not making enough money to be able to be self-sustaining and have their own independent insurance to cover workman's comp, they had to take the state insurance?
Yes. And that particular year, it was Accident Fund of Michigan. And I think it's terrible, and I know it was even bad for my employers, that there's no competition in that industry. Basically, per county or per state, there's like last provider of choice that, if you don't set up your own system, that's who you get. And the companies pay very high rates. And then what's really a shame is I thought maybe my case was just questionable or, maybe there was something wrong. And then I found out, no, that all the roadblocks that I encountered was typical for the system.
Did you think initially that the insurance that the company had would cover a workplace accident?
Oh, yes. In fact, my company did not even understand why initially I wasn't getting everything that I needed. When our safety team reacted, they did everything by the book. In fact, for a small company who self-trains for people, a manufacturing company, excellent. And the fire department, who normally did not do the EMT response, but were the only people and the only vehicle available in our area that day, came out. They provided excellent care.
Where were you at now?
At a facility called Uniboring in Detroit.
And what kind of work was that?
Well, I was a quality technician,
okay.
But it's a manufacturing plant, automotive support plant, all different types of parts for the automotive industry and some smaller parts for other different industries.
Okay. So how did you actually end up getting injured at work?
I was thrown back into what we call a train well exiting one of the buildings. And unfortunately for me, a combination of the fact that that door had to be a security door because of the location, because of it didn't have close proximity to the offices or any place else where it could be observed.
Mm-hmm.
So it had to be a self-closing door that would close and lock itself when we exited. and the self-closing mechanism combined with the wind force along the side of the building that day, it just made the door close so forcefully that it threw me back into the train well.
Okay. So you say well, how long were you in the train well?
I would say maybe 5 or 6 minutes. We're pretty fortunate that each machining area has a supervisor on duty. They can also talk to each other in the offices. Our what we call floor captains and foremen, they make rounds, and I wear a white lab coat, so I was highly visible.
Okay.
Even though the area that I was in was 3 feet lower than the machining floor, as the supervisor came down to make his rounds, I just held up my clipboard, and he could see me, and he says, "Oh my gosh," he says, "wait right there, I'm coming for you." And immediately he came down and, said, "How are you?" and, what happened, and then they called by radio, and it actually took the ambulance longer to get to me than it took the safety team to discover me and take care of me. They immobilized me, they covered me, and started checking my vital signs.
So you had a really good team at work in place in case something happened.
He knew that employees made the business, and we were important to him. In fact, our health insurance that we had, our short-term disability, optical, dental, all the other insurance plans that we have were some of the best that I encountered through my career.
Okay.
And they had only ever had one other, large workers' comp claim, and it had been years before. I don't know at that time if there was a different provider. I know over the years there have been a couple others, but they did not expect this kind of thing with the workers' comp people either.
And so with the problems that you were having and with your employer being on your side, did it make it any easier? Did it facilitate things?
It really didn't. The insurance company, basically, they have a set plan that they go by. My biggest part of my accident was a back injury that caused some paralysis. My first problem was encountered when I got to the hospital. I found out immediately that even though I came in by ambulance and I was considered a severe accident, and at that point the EMT said that they thought I had a dislocated or fractured hip. They knew I had spinal injuries, possibly a concussion, possibly internal injuries. And
so you fell a long
I was
way.
already shocky. No, actually the height was only 28 inches, but I was thrown. Because I was swept completely off my feet, I pretty much sailed through the air, so there was a lot of impact to my left hip. And that just, stunned. Well, I could feel ripping and tearing in my body on impact. And then when I just rolled a little bit onto my back, my leg and hip stayed pinned to the floor at a really odd angle. That was the first clue that our safety team and the EMT said, "Oh, don't even try to move. This is serious."
Send me an ambulance when I need one. Give me something for my pain. Tell the government to pay the hospital. I'll be back on my feet.